current prevalence rates for autism continue to grow. Because of that, there's been an increase in the need of accessibility of services to children with autism and the families. However, we have seen, with our growing wait lists, we saw the need to expand our services so that we could serve more children at a time, and putting it in a place where we could make sure that families in the area could access the services much more easily.
We know that research shows that the sooner we can get intervention for kids, the better. So the younger we can get them, if we can get them as young as 2, that's great. The more intensive too, so the more hours a week that we can get early on, the better outcomes we see. And our goal is to really provide that intensive services early on so that we can hopefully integrate kids back into typical classroom settings, and so that they need less services in the future.
We were seeing a huge barrier just with our geographical location of the clinic. So we were seeing families that were getting enrolled in our services, and then it was hard to maintain coming because they were having to drive half hour, 45 minutes across town.
Like in this case specifically, the other clinic is located all the way on the other side of town. So for families who live on this side of town, who may be part of households that don't have a plethora of resources and be able to get their children to and from those services, it's nice that it's on a side of town that needs the resources, and it's a little bit more convenient for those families who want to partake in the services.
The reason why I love this job so much is I had a previous client who was nonverbal, and so he was using a lot of different ways to communicate with a device and stuff, and then him first saying his first word, and then now being verbal and being able to be hi or bye, and seeing that progression, it's amazing. And I think that it means a lot when you're working with a kid every day, and you become a huge part of their day. And so when he spoke his first word, I probably cried more than his parents, which was kind of embarrassing, but I'm really proud of all my kiddos and just seeing their progress.
Our son Ethan is 7 years old. He was diagnosed with autism about age 2.5.
Ethan, what do you want for your birthday? Croutons.
He didn't talk until he was 4.5. And so we were all very worried that maybe speech would never come or would be something that was difficult. And after basically 1.5 years or so of working with Ethan in speech and in all the other areas that the ACT Clinic provided, they were holding him in front of the alphabet, and he said E.
What's your name?
E!
Which was the first time on video that we had it, and it was the first time that he had said something and really had control over his voice, so we call it finding his voice, and that was just so awesome. That was when we kind of realized that everything was going to be okay.
We knew everything was going to fall into place.
I think it's the quality of care that we're able to provide. So we're able to provide very intensive one-on-one services. We've got very highly trained staff working with the kids, really great training programs. There's also other stuff that makes me excited is our focus on caregiver training too. So really bringing the caregivers into intervention.
Dason is an energetic 5-year-old who is full of curiosity and comedy. We were having a lot of meltdowns prior to receiving services at ACT Clinic, and those have really minimized to where he's learned to express his feelings, and he's learned some coping skills when he gets those really big feelings. ACT Clinic benefited our entire family. Just knowing that we had their support at any time, that it was just a call to the clinic or an email away whenever I had a question, a frustration, whenever I wanted to take a new direction. They have been amazing for us.
The most meaningful thing for me working in our clinics is to be able to empower families that we serve to have just better interactions with their child, feel empowered that they can adequately care for their child. The other piece is, I think for a lot of us, when we do this, is just seeing the clients make progress and such great gains and improvements so that they can transition and function and be a part of the community as well as interact with their families.
I absolutely love the ACT clinics. I'm very excited that we have the Action Clinic now, and I hope that we continue to be able to grow and expand so we can reach multiple different communities and give more access to services all over the metro and then hopefully all over Nebraska one day.